What is an audiologist? In this video, I'm going to teach you what an audiologist is and how they differ from other hearing loss professions. Coming up. Hi guys, Cliff Olson, Doctor of Audiology and founder of Applied Hearing Solutions in Anthem, Arizona. And on this channel, I cover a bunch of hearing-related information to help make you a better informed consumer. So if you're into that, consider hitting the subscribe button. When I tell people that I'm an audiologist, the most common response that I get is, "What did you say?" And the second most common response is, "So you work on car stereos or something like that?" The truth is that not a lot of people know what an audiologist is, but when it comes to anything hearing loss related, audiologists are the experts. Audiologists can function independent from other healthcare professions. This means that you'll find them in a variety of settings, which include hospitals, schools, ENT offices, otology clinics, private hearing aid dispensing clinics, you name it, they can pretty much function in any environment. The profession started in the 1920s, but the term audiologist wasn't coined until around 1946 when service members were returning from overseas from World War II with noise-induced hearing loss. Since that time, like many professions, it has progressed to the point where in 2007, it became required to get a doctorate in audiology to become an audiologist. Becoming a doctor of audiology requires a 4-year undergraduate degree followed by a 4-year doctorate degree in audiology. Before 2007, it was only a master's level degree, which was a 2-year requirement. This intensive training ensures that audiologists have a detailed understanding of the anatomy and physiology of hearing and balance. It also requires that they understand psychoacoustics, research processes, diagnosis of hearing loss and balance disorders, and a variety of different treatments for hearing loss. These treatments include hearing aids, cochlear implants, bone-anchored hearing devices, middle ear implants, you name it. If it has to do with hearing loss treatment, audiologists are trained in it. Audiologists are trained to work with a variety of different patient populations, all the way from infant up to geriatric. They are trained in auditory rehabilitation, can perform surgical monitoring, and are also trained in counseling. Most audiologists will end up specializing in a very specific area within audiology, but by the time they're done with their training, they have a complete understanding of every aspect of how humans hear. All audiologists are licensed by their individual states. Some become board certified, and all of them are required to obtain continuing education hours. So how do audiologists differ from otolaryngologists, otherwise known as ear, nose, and throat doctors, or ENTs? It's important to understand that unlike audiologists, ENTs are medical doctors, which means they went to medical school. This gives them the ability to treat certain medical conditions related to the ear, nose, and throat. When it comes to ear-related conditions, they typically treat these with medications and with surgery. Some of these ear-related medical conditions can include sudden sensorineural hearing loss, ear infections, tumors, trauma to the ear, deformity of the ear, and things like that. It's important to understand that ENTs do not fit or program hearing technology. Anytime that hearing technology comes into play, they end up referring to audiology. What this means is that if there's an ear condition that can't be treated medically, they'll refer to audiology. If they treat a medical condition and it still results in a hearing loss, they will refer to audiology. And after a surgery is completed to install some kind of device like a cochlear implant or a bone-anchored hearing device, once that surgery is completed, they will refer to audiology for the programming of the actual devices. Now, over 90% of hearing loss cases are actually non-medically related, which means that you are more likely to be working with an audiologist than an ENT when it comes to hearing loss. Okay, so now that you have a good understanding of the difference between an audiologist and an ear, nose, and throat doctor, I'm going to go into the differences between an audiologist and a hearing instrument specialist. So clearly the biggest difference between an audiologist and hearing instrument specialist is the amount of education that's required. As I explained before, audiologists are required to go through 8 years of education to become an audiologist now, where it is very typical for a hearing instrument specialist to only require a high school diploma, some kind of observation period where they work with another hearing instrument specialist or audiologist, and then some kind of state examination in order for them to become licensed in that state. On top of that, their scope of practice literally encompasses only hearing aids alone and does not require them to have any knowledge or understanding of anything outside of hearing aids. Now, I want to make sure that you understand that I'm not saying that hearing instrument specialists are bad. I'm just saying that they definitely have a limited scope of practice when it comes to hearing loss and balance disorders. But if you're the type of individual who just needs a hearing aid, there are some good hearing instrument specialists out there that might work great for you. Now, if you have any hearing related issues, going to an audiologist or ear, nose, and throat doctor is a great first step. Even if they're not the exact right specialty for you, they'll be able to get you pointed in the right direction. All right, guys, hopefully this video has given you a better idea of what an audiologist is and how they differ from other hearing care professions. So the next time you meet an audiologist, you can say, "Oh, an audiologist? That's a hearing doctor, right?" That's it for this video. If you have any questions, leave them in the comment section below. If you liked the video, go ahead and give it a thumbs up. And if you want to see more videos just like this one, go ahead and hit the subscribe button. I'll see you next time.